I'm Kelly Warner. Flu season is in full force in Oregon, resulting so far in hundreds of ER visits, hospitalizations, and the deaths of 2 children. And it's estimated that it could be 2 to 3 more months before this year's flu season is over. So healthcare providers say if you and your children have not yet gotten a flu shot, don't wait. In her 25 years as a pediatrician, Dr. Pilar Bradshaw has seen her fair share of flu seasons. So she works hard to help families separate fact from myth when it comes to this dangerous virus. Myth number 1, the flu is just a bad cold. That's false.
Influenza is not just, oh, I had the flu this weekend. No. Influenza is a hideous high fever for a week with terrible body aches, chills. You're sick in bed. Coughing and a lot of respiratory symptoms, sore throat, congestion, cough.
Myth number 2, you can catch the flu from the vaccine. Again, false. The flu vaccine is made from an inactivated virus that cannot transmit infection. And myth number 3, if you get the flu, the shot didn't work. Not necessarily. It's difficult for scientists to predict perfectly which strains of influenza will be dominant each year. But if you do get the flu, having had the shot can lessen the severity of the symptoms.
Is it possible that you're going to get a case of influenza the year that you got a shot? Yes. Is it likely that if you hadn't gotten the shot, that you would have been sicker with that influenza infection? Yes.
While the flu vaccine doesn't offer 100% protection, Dr. Bradshaw says it's the best insurance we have against a terrible and potentially deadly illness.
Influenza is not a benign illness. I think people sort of blow it off, but they have to remember influenza kills more people every year in the U.S. than all other vaccine preventable disease combined. It's a big deal.
It's not too late to get a flu shot. Call your doctor, the public health department, or visit your local pharmacy. I'm Kelly Warner.